Only for this lecture, you will see the competency-based lecture class, what should comprise in these lectures. There is some specificity of the lectures. Every lecture should have some specificity as per the CBAB program. And this program based on this. Awareness of the culture, on the cultural beliefs and practices of breastfeeding. This awareness is essential. Let us go to that point. What are the awareness in relation to the breastfeeding? And what are the different taboos? কি কি সব উল্টোপাল্টা মানুষের মনে ভাবনা আছে in different community in breastfeeding. এটা তোমাদের জানতে বলছে এই জন্য যে this problem will face these problems when you do the practice in the hospital or in the outside, in the office practice. You will face the problems, these type of problems. Let us go to that problem. We will come to this. We will come to this. Social stigma. Now, what are the social stigma present in breastfeeding related? Actually, we may not follow this. আমাদের সাধারণ কনসেপশন থেকে যা মনে হয় সেটাও আমরা আলোচনা করতে পারি। আমাদের শুধু এই লেকচার ফলো করার জন্য দরকার নেই। You can memorize আমাদের সামাজিকভাবে আমরা what we know from our day-to-day observation in relation to that. Everyone, you are coming from one section of people. What is the idea about or what is the awareness of breastfeeding? Or what are the different taboos in relation to breastfeeding or social stigma? এইগুলো একটা একটা করে যদি তোমরা বলতে পারো তাহলে সেখান থেকে কিন্তু বেরিয়ে আসবে what are the social stigma বেরিয়ে বলো এবার থেকে শুরু করো বলতে শুরু করো তুমি বলো স্টার্ট করো কি কি সোশ্যাল স্টিগমা আছে কুসংস্কার কি কি আছে বা ভালো জিনিসই বা কি কি আছে ব্রেস্টফিডিং সম্বন্ধে একটা যে কোনো বলো তোমার জানা থাকবে তোমার জানা নেই তোমার এরিয়াতে তোমার কিছু জানা নেই বুঝলো বলো মায়ের যদি গ্যাস হয় তাহলে বাচ্চারও গ্যাস হয় দেখো এই একটা কিন্তু আলাদা সোশ্যাল স্টিগমা মায়ের অ্যাসিড হচ্ছে মা খাচ্ছে বেশি বাচ্চার গন্ডগোল হয়ে যাবে মা কম খায় না কম খায় বাচ্চা সেগুলো রোগা হয়ে যাচ্ছে এই সমস্ত ধারণাগুলো আছে কিছু একটা বলবে বসো কিছু একটু বলতে পারবে ওটা তো জেনুইন কারণ ওটা তো জেনুইন একদম ওটা কিন্তু স্টিগমা কিছু না স্টিগমা মানে হচ্ছে দোজ ওয়ার নট কারেক্ট ঠিক নয় অথচ সেই ধারণাগুলো আছে মিথ ভুল ধারণা যেটা ভুল ধারণা এনিওয়ান ফ্রম দিস সাইড যা মনে আসবে এমনি তোমার ইয়ে নয় কিছু এটা কিন্তু পড়া ধরা হচ্ছে না পড়া ধরা হচ্ছে না বা তোমার এটা বলতে পারলে খুব বিরাট কিছু না বলতে পারলে কিছু না এরকম কিছু ঠিকই তোমার ধারণা মনে হয় এটা অনেক সময় মনে হয় যে বাচ্চা হওয়ার পরে কি ব্রেস্ট মিল্ক হবে না অতএব বাচ্চাকে অন্য কিছু খাইয়ে দেবো এটা একটা তোমার ধারণা আছে এটা ভুল ধারণা নেই অ্যাকচুয়ালি বেবি নিডস colostrum the first secretion in the milk colostrum and milk but the conception is that the milk is not produced in the first few days so give other foods আরেকটা কনসেপশন কি বেবি ইজ ক্রাইং আফটার বার্থ it is natural the baby will cry after birth because of the different environment and different stimulations. But what is the myth is that the baby is crying because baby is not getting enough breast. This is the myth. This is the belief of many people. Even the healthcare provider, sister, ফ্যামিলি নেই, তাদেরও একটা ধারণা আছে যে as the milk is not there, that's why the baby is crying. But actually baby is not crying due to not availability of the milk. Baby is crying because the baby is exposed to different environment. This is the reason. So these are the false beliefs or myths which are present. The NMC likes that you should know what are the false beliefs that we have in. So there are also lots of other beliefs are there. The mother is suffering from some problems. As Mandira said, that baby will also suffer from that problem. These are standard. As the mother and the other persons in the family, they are not seeing what is the baby is eating, what is the baby is feeding. Actually, in case of artificial feeding or say baby food feeding, they can see what is going to the baby's belly. In case of breastfeeding, they are not seeing what is going to the baby's belly, what baby is taking. Myth originates from that. They think that baby is not getting enough. What is required? What is required for the baby, that is not getting the baby from the mother. So it is the habit of the family, not all, but few families, they do not support the mother for breastfeeding. This is an important thing. And that's why what is happening, they are giving the pediatrial milk before establishment of sufficient lactation. They are giving the milk to the babies. Candy water, sugar water, plain water. And they are giving to the baby. And what happens, this pediatrial feed can give rise to infection, because baby is not immune, less immune in comparison to others. So there are chances of infection. At the same time, it decreases the effectiveness of the breastfeeding. This is a dangerous failure of the breastfeeding. It initiates the failure of the breastfeeding. And also mother is suppressed. And probably everyone the correct. And probably breastfeeding is not there. Once mother thinks that breastfeeding is not there, it will be automatically suppressed because of the hypothalamic suppression. If there is any anxiety, any tension, any fear, any question raised in the mother's mind, that can suppress the hypothalamic stimulation necessary for the breastfeeding. So end result is lactational failure. So the social taboo, the social stigma, that's you should know that these are the presence and this should not be there. So this is very important thing there. So these are the data that, in spite of repeated discussion, in spite of learning the importance of the breastfeeding from the very early life, even from the class 11, 12, or 9, 10, etc. science, till a substantial portion of the baby are not getting breast milk properly as it is needed. So that is the concern. Everything is established. benefit of the breastfeeding established. Breastfeeding should be given and it should be the only food for the first 6 months of life. That is established. Every students, they learn that this is required for that. In spite of that, more than 50%, more than 60% say they are not getting the chance of as per the requirement of the breastfeeding. There is exclusive breastfeeding up to 6 months, and then complementary feeding along with the breastfeeding up to 2 years. What is the teaching is that? Teaching is that exclusive breastfeeding should be up to age of 6 months. And from 6 months onwards, in addition to the breastfeeding, we should give complementary feeding. And minimally it should be 2 years, maybe above 2 years also, but minimal duration should be up to 2 years. Now we will discuss what's the importance of these 2 years. Now, these are the different terminology, you know, that exclusive breastfeeding, it means only breast milk baby is taking, or any vitamin D3 drop which are recommended itself, or if there is any medication requirements. So exclusive breastfeeding feeding is concerned only with the breast milk. Exclusive breastfeeding. Predominant breastfeeding means the mother is giving the breast milk baby, but occasionally 1 or 2 twice mother is giving additional feeding. Predominant breastfeeding. Partial breastfeeding means near about half other feeding, half breastfeeding. Complementary feeding means in addition to breastfeeding, we are giving other foods. These are required from 6 months of, after 6 months of age. Up to 6 months, you should give the breastfeeding, and after 6 months, you should start complementary feeding along with the breastfeeding. Donor's human milk, one mother is giving milk to the other baby. That's called donor's human milk. Now, mother's own milk, it means the donor's human milk may be from the mother or from the other mother. Right? Mother's own milk means only mother is giving the milk, no other milk. Human milk, both mother and donor's milk. Now there is concept of milk bank. Bank is there. In India also at different places, human milk bank is there. And any baby who is not getting enough milk, they can take milk from the bank. Now, fresh milk means the breast milk is expressed and that is given fresh. And the frozen breast milk means breast milk is kept in the deep freezer frozen. It is usually in the milk bank. You can keep the breast milk, say, in the normal temperature for several hours. If you keep the breast milk in a steel container, etc., it may be present for 24 hours. If you keep in the fridge, it will be present as such, no problem, in 48 hours. But you should not heat the human milk which is kept, because that will destroy the essential components, some essential components of the milk. You know this terminology. Advantage of breastfeeding, that is discussed in different classes, in the community medicine class, gynae classes, and is also discussed in the previous classes in pediatrics. What are the advantages of breastfeeding? The most important, in addition to the nutrition, the most important thing is the immunity to the baby. Immunological components of the breastfeeding. This is very important. And the bonding between the baby and mother, very important. Also the components which are present, the nutrients which are present in the breast milk which is essential for the particular baby. Suppose a mother has baby of 32 to 33 weeks. The milk which is produced by the mother that is suitable for that 32 weeks baby, preterm baby. This is very important. So as per need of the baby, mother will produce milk. This is the gift of the nature, gift of the superpower. The mother is equipped with that such important function. So definitely that will say, you know all the advantage. I can see it's very right. Can easily write down what are the advantages of the breastfeeding. So we will not discussion further. This is the structures you know in the anatomy, the important structures. But I am just repeating this. This is a repetition of the previous discussion. The structures you know that the important thing is that this is the nipple and this is the lactiferous sinuses where the milk is collected first and milk is produced here. There is the gland, secretory cells, and outside cells are myoepithelial cells. Myoepithelial cells. So milk is produced by these cells in this gland, and how the milk is produced? First, formation of the breast by secretion of the hormones, prolactin, and the prolactin is secreted. Prolactin is a best formed by the estrogen and progesterone whose level are increased during pregnancy. So during pregnancy, the level of the estrogen and progesterone increased and helps in the secretion of the prolactin, which helps in the formation of the maturity of the glands and is ready for secretion of the milk. Estrogen and progesterone makes the breast ready for the secretion of the milk. As soon as the delivery occurs, the level of the estrogen and progesterone is decreased, and the other hormones, I will show you that, they starts acting and there is release of the milk, formation and release of the milk. So this is important. And the milk is produced here and the myoepithelial cells that will contact and push the milk to the lactiferous sinuses, and this dot point are areolar region, and the baby is sucking this milk here by giving positive pressure. So that's why we say that we put the areola and the nipple inside the mouth of the baby, because if the baby pressed here, milk will automatically come out. So breastfeeding is only by positive pressure of the baby. It should not be negative pressure. If the baby sucks only the nipple and less amount of areola, baby will have to suck by the negative pressure. That is not good. That can give rise to aspiration. What is important is that it should be by positive pressure. So areola should be inside the mouth of the baby. Now, these are the points: positioning, attachment, and position, attachment. These will be discussed in the practical classes. This is called the demonstration. So they will have to demonstrate it in the word or দেখানো হবে attachment কাকে বলে, theoretical পড়ে কোনো লাভ নেই, জানো তোমরা, but that is not needed here now. But this is needed. This is given included in the lecture. So how the milk is produced? This you know that prolactin, milk formation and the milk formation, prolactin is very important hormone. prolactin. And this is another important hormone is secreted from the hypothalamus, oxytocin. What oxytocin does? It helps the contraction of the myoepithelial cells. Myoepithelial cells, you know, it is present. They are surrounding the gland where breast milk secretion occurs. And if the myoepithelial cells contract, then milk will come into the lactoferous sinuses. So oxytocin helps in contraction of the myoepithelial cells. And prolactin secretion and formation of the breast, secretion of the breast milk. So these are the two things which are important, which you should know the function of this. Any type of stress, strain, any anxiety that inhibits this process. They inhibit this process. And there are chances of lactational failure. Now all these things they are important. Lactational failure causes. This is important if the baby is giving top feeding or other feeding, pre-lactal feeding, there is chances of lactational failure. We have discussed family pressure and other things. Okay. Now, benefits of breast milk. I think there are 1,000 benefits of breast milk. In addition to the nutrition, lots of benefits. And important things is simple things is carbohydrates. Carbohydrate contains the important thing lactose. These lactose break down into glucose and galactose. And they are giving energy. This is good. And galactose is absorbed and goes to the brain and forms the galactocerebrocyte. So it is helping in the formation of the brain structure. Right? So this is important of the lactose. At the same time, the lactose helps the galactose and lactose glucose. It helps in the formation of the good bacteria or beneficial bacteria in the intestine, which is helpful for the baby. Now, go to the protein. Protein contains usually taurine and cysteine. Very helpful for the brain maturation. Other function of the protein as like say, giving some structure formation, muscle formation. I am giving the specific importance of the protein, this taurine and cysteine. These two acids, they are very helpful for the brain formation. These are the important points for extra importance. Fat. The importance of fat, it gives also energy. But other things is that it contains the omega 3, 2, 6 polyunsaturated fatty acids. I know you know about the omega concept of the fatty acids. Now, why the omega 3, omega 2? Why they are omega? Why it is omega? You should know from the study of biochemistry, the position of the double bond is demarcated by the either suppose there is a chain like this, you can demarcate the position of the double bond from the left side or from the right side. If it is started from the left side, then the number is given as 1, 2, 3, 4, etc. If it is started from the right side at the end, double bond, then omega 1, 2, 3, omega 1, omega 2. For demarcation of double bond. Demarcation of double bond, omega is given. Now this omega 3, you know, is important for the brain maturation. Omega 2 gives rise to formation of the prostaglandins of the brains. 6 are also essential for the brain formations. So these are the importance of omega fatty acids. Vitamin minerals are there, water, electrolyte, adequate, and immunological function of the breast milk. I think all of you know that it contains large amount of antibody, IgA, secretory antibody. That is IgG also present. IgM usually cannot pass because of the large molecule. But IgA amount is higher. Besides that, there is the macrophage, lymphocytes, etc. These are present. Now, lactoferrin present in the breast milk. It prevents the growth of the bacteria, harmful bacteria. It inhibits the iron supplementation to the harmful bacteria. This is the lactoferrin. The importance of the breast milk. The lysozyme, you know, that kills the bacteria. And the bifidus factor, lactobacillus bifidus factors. So it helps in the growth of the helpful probiotics inside the gut and the interferon killing the viruses. So other important things are there. I am giving only the headlines there. Only the headlines are there. You will learn this. It is already discussed before also. Both factors present in the breast milk, the epidermal growth factor, breast milk lipase is very important lipase. It helps in the digestion of the fat. At the same time, any parasites which may enter inside the intestine in the breastfed baby, the wall of the parasites contains the lipid which can be digested by this lipase. So that's why the intestinal ameliorasis or giardia, etc., they are less common, or say helminthiasis, less common below the age of 1 year, because the baby is solely dependent on the breast milk for almost breast milk up to 6 months. Then after that, breast milk contains adequate amount of lipase, which breaks the wall of the parasites. Not possible after that age. That's why we recommend the anti-L milk after the age of 1 year, may be given if it is required. But helpful is that breast milk contains lipase, not only breaking the fat inside that, but also kills the parasites also. This is important. And it also benefits the mother also. How the mother is benefited by the breastfeeding? Because the oxytocin is released during breastfeeding and it helps in contraction of the uterus. So the transformation of the postpartum uterus towards the prepartum uterus. This is important. Also, the breast milk adequate releases the changes in some sort of changes in the breast in the postpartum period. It can be prepartum period. And also incidence of the postpartum hemorrhages, that is also less. And also the malignancies, breast cancer and uterine cancer incidence also less in breast milk. Incidence are less. And most important thing is saying poor people, they can give lactational amenorrhea. During the period of breastfeeding, initial 6 months, there will be amenorrhea. So it gives the further pregnancy, prevents the further pregnancy. Is it clear to you? It prevents the. These are the different benefits of the mothers also. Other benefits, most important thing is the satisfaction. Satisfaction is very important. Satisfaction and the bonding, mother-child bonding, emotional bonding, that is also very important. That's why you are giving the first, just after delivery, there is a conception known as breast crawling. The conception is the breast crawling. That is just after delivery, put the mother on the mother's abdomen. Put the baby on the mother's abdomen, and it has been found baby will crawl. Baby will crawl and towards the breast. Baby crawling. This is the concept now. After cesarean, it is done in some centers also. After cesarean section, when the baby is delivered, or after normal delivery, when the baby is delivered, just after birth, keep the baby in the mother's abdomen, and baby naturally towards the breast, close to the breast, and baby will go breastfeed. What is the importance is that very strong emotional bonding between the mothers and baby, very strong emotional bonding, and there is initiation of the breastfeeding earlier, just after birth, and also the mother's bonding and satisfaction. So breast calling is very important concept for the other. So these are the things in say benefits of the mothers. Go to the composition, I think it is already discussed, you see, everything, and I have told you that preterm milk and let's say mature milk, they are different. Preterm milk contains more amount of protein. Okay? And that's a big mother who is giving delivery to a preterm baby. Milk is adjusted towards that for the what is the requirement of that baby. And the colostrum is very important. The first 3 to 4 days is period. First 2 to 3 days. The milk, not in very large amount, is equally small amount of colostrum, but there's huge amount of antibodies and immunocompetent cells. The importance is that the baby who are getting colostrum after birth, it has been found, it contains the growth factors which helps in the growth of the intestinal cells and also a protection. Colostrum gives a protection, protective layer in the baby's intestine, protective layers in the baby's intestine, giving rise to lifelong protection. It is not the exaggeration of the any activity of the breastfeeding. It is proved that it gives rise to the colostrum giving adequately in the first few days after birth, give rise to the lifelong protection to the baby's gut. This is important. So, regarding the vitamin D, some sort of deficiency of vitamin D which is required by the baby may not be adequate. It contains vitamin D, but supplementation may be given to the baby up to the age of 1 year. But now there is it is proved that vitamin D, only vitamin D in the newborn baby up to the age of 1 year, there is some little amount of vitamin D level. That's why supplementation is necessary. Research is going on. Is it really necessary in India or not? Because we cannot keep the baby in the sunlight. What is the reason we cannot keep the baby in the sunlight? Is that sunlight contains ultraviolet rays, and that can lead to problem with you. So, what's the ideal time for the sunlight? Is from 10 a.m. to 3 p.m. only for the few minutes, 15 minutes. If you keep the baby in this hot summer after 10 a.m., no mother will accept this. It is not possible. It can be led to sunburn also. It can be led to dehydration also. So that is the reason that the family are adapting so better to give the vitamin D supplementation rather than natural. And it is also found that even after giving exposure, till supplementation is necessary. Up to this finding up to the last year. These research findings is up to the last year publications up to 2023. I don't know what is 2024. Up to 2023 publications collected evidence. Till even giving the vitamin D outside, is some sort of vitamin D deficiency present in the baby. So it should be supplemented up to the age of 1 year. In no other cases, vitamin D supplementation is necessary. If they keep themselves exposed to sun only for 30 minutes once in a week, okay. So this is the importance of this. Now, transitional milk is the full phase of breast milk and the colostrum. So middle period is transitional milk. That is also not very important to you. I think you have read several times this comparison between the human milk and cow's milk. It is as it is given in the your syllabus. That's why I am mentioning this. The most important thing is that if you look at the protein content of the cow's milk, it contains huge amount of protein, near 4 grams of protein, 3.5 or 4 grams of the protein. So this protein load is very harmful. Other human beings is 0.9. If you can say remember 1 gram of protein per 100 milk. This is important things. Even you see the lactose in the cow's milk, and I am telling only the importance of these things. What importance is that protein content in the cow's milk is higher, which is damaging to the baby. And also the lactose in human milk is 7 gram, whereas cow's milk is 4 gram. But till the lactose can be digested easily from the human milk, not from cow's milk. This is very important. It is so adjusted that human milk lactose can be easily digested. But cow's milk lactose is very difficult to digest. Also, other important thing is that cow's milk contains the fat, and the importance is that it can give rise to soothing of the satiety center. This is very important. A mother is giving breast milk to the baby, and after say 2 hours or 1 hour, baby will be again hungry. Baby likes to take another thing. But if the family gives cow's milk to the baby, 3 to 4 hours, baby may not take any cow's milk further, any food further. So that is one point for family. They claim that this food, when I am giving to my baby, baby is not crying. But when the baby is giving mother's milk, baby is crying after 1 or 2 hours. In spite of adequate weight gain, this type of observation forces the mother to feed the cow's milk. Now, what is the reason? The fat contains the cow's milk. It soothes the satiety center. We know that we have two centers, appetite center and satiety center. We have two important centers, satiety center and appetite center. Breast milk, the appetite center is fulfilled, but to enhance the demands of the nature producer, the satiety center is not suppressed like cow's milk in case of breast milk. So breastfed baby demands feeding frequently. And mothers will tell you that I am feeding the baby, immediately after that, the stomach is empty, abdomen is empty. It means breast milk is so adjusted with the baby, as soon as the mother is giving the breast milk, it is directly going to the baby's blood. There is very little waste. And sometimes it has been found baby is not passing stool for 5 days, 6 days in case of breastfed baby. So a breastfed baby may not pass stool for few days, several days. And we should not stamp it as constipation. If the baby is otherwise healthy, everything is normal, you should not stamp it as constipation. Okay? So this is important thing is there in case of difference between the cow and breast milk. I will not go further. And also the calcium phosphorus ratio is not so good in case of cow's milk. And the antibodies and the essential fatty acids which are required in the baby do not present adequately in the cow's milk, which is present in the human milk. So in case of different illness also breast milk may be given. We are not going in details in the breast milk in different illness. And there is no problem to stopping the breast milk in any illness. Even in HIV infection also, we do not say that breast milk should be stopped. And there is diversity of opinions. Suppose a mother is from very wealthy family and the mother is suffering from HIV disease. Naturally, she may not want that baby because even the transmission is low, but it is proved the virus can be transmitted from the breast milk. So if the family is capable enough to give the sufficient amount of the artificial feeding to the baby, now, except in those cases, in India, in our country, in a very poor socioeconomic country, usually even HIV infection in mother, you give the treatment to the mother, give the prophylaxis to the baby, and give the breast milk to the baby. Because that if you do not give it, nutritional deficiency will kill the baby. This is the problem. Okay. In case of tuberculosis, also treat the mother tuberculosis. Give the baby oral oxygen, invest the baby. Investigation do the baby whether it is what is there, but breastfeeding should not be stopped. So in case of other similar things, in case of other cases, mastitis, breastfeeding, etc. Except in critically ill baby, you should give the breastfeeding. In case of platelet and cake palate, also breastfeeding maybe should be given, but there is separate technique you should know, and that will be demonstrated practically during the practical classes. Problems of the breastfeeding. বন্ধুরা দেখো দেখি এটা আছে নাকি প্রবলেমস অফ ব্রেস্টফিডিং ওদের কারিকুলাম আছে নাকি So problem of the breastfeeding, important problem is that sometimes the nipple may be inverted. Nipple, in spite of instead of projection to the outside, may be inverted. And actually, the antenatal doctors or gynecologists should examine the nipple also during pregnancy period and give the necessary advice for the elevation of the nipple. If the nipple is inverted, the baby will not get the breast milk. And this is the process how the inverted nipple can be everted. I think you know that process, no? Know that process, that is, you know this process, how the nipple suppose inverted, this is the inverted nipple. How the nipple should be everted, this is the process. The PSM or conservative medicine or physiology, not discussed, gynecology not discussed. So we have to discuss. You take a 10 ml syringe, take this 10 ml syringe, cut here, and take the pistol out and push it in the reverse direction. Is it clear? নেই না এগুলো নেই তো তাহলে আমরা এগুলো বাদ দিয়ে যাবো তো এইটা জাস্ট বলে দিই এগুলো প্র্যাকটিক্যালি করতে হবে তখন তো ডিটেলস কিছু পড়ানো আছে অনেক সব বাদ দিয়ে ছোট কোর্স করে দিয়েছে তো এটা পুশ করে দেওয়ার ভেতরে দেন ইউ ড্র দ্য গ্লাভস ঠিক আছে সো দিস ইজ ইম্পর্টেন্ট This is important thing, nipple will come out. Professor Nimora Dalande got Rashtrapati Puruskar for this President Award from Karnataka. And first she told that this is the process by which inverted nipple can be made straight. Okay? So, I think এগুলো নেই তোমাকে তাই তো এরপরে আমরা কোথায় যাচ্ছি কি আছে বলো এরপরে 7.8 তাহলে বুঝতে পারছো আমাদের লেকচারে বিশেষ কিছু নেই তোমাদের কোর্স ছোট করে কোর্স করে দিয়েছে কোর্সটাকে ভাগ করে দিয়েছে লেকচারে টিচাররা বড় করে বলে যাবে সেরকম না এবার ডেমনস্ট্রেশন লাগবে This is the lecture portion is finished. Demonstration portion যেগুলো আছে সেগুলো সব ওখানে লেখা আছে demonstrate this হ্যাঁ বুঝতে পারছো লেকচার থাকলে এই লেখা থাকে demonstration থাকলে নো হাউ মানে কেস লেখা থাকবে এইসব করে লেখা আছে তাহলে এটা হলো তো আমি কি একটা প্রশ্ন করতে পারবো প্রশ্ন করতে কিন্তু ভয় লাগে কারণ পরের দিন ক্লাসে দেখা গেল সব অ্যাবসেন্ট হয়ে গেল 4-5 জন ছাড়া কিন্তু প্রশ্ন করা মানে এই নয় যে কোনো রকম কোনো ডিমার্কেশন নেই কিচ্ছু নেই খারাপ কিচ্ছু ভাববো না প্রশ্ন করে বুঝবো শুধু যে আমাদের ক্লাসটা নিয়ে একটা সার্থকতা কতটুকু হলো আদৌ কিছু গেল না সবটা জলে চলে এইটুকু বেরোচ্ছে ঠিক আছে কিন্তু আসতে হবে ক্লাসে এরকম ভাবলে আমরা ছাত্র পড়ার ধরে যাবো না বুঝতে পারছো এরকম হয়েছে আমার যেখানে 200 তো আমাদের নিজের স্টুডেন্ট পড়া ধরতাম বলে। সেরকম একটা গল্প বলি সময় একটা ছেলে ছিল, তার শুধু গোলমাল করতো, তো প্রায়ই আমি তাকে তুলতাম, 200টার মধ্যে তুলে বলতো কি পড়ালাম বলো তো একটু আগে, বলতে পারতো না, বকুনি খেত। সেই ছেলেটি কিছুদিন আগে একটা হোয়াটসঅ্যাপে বড় মেসেজ পাঠিয়েছে আমাকে, বুঝলে, স্যার আপনার চাই আমি ছাত্র যে খুব বকুনি খেতাম, আপনার কাছে বকুনি খেয়ে একটা জিনিস শিখেছি যে আমাকে পড়তে হবে। এই মেসেজটা বলাটাই আমি বলে দিচ্ছি। তো আমি স্যার MBBS পাস করার পর MS করেছি, তারপরে DNB করেছি, তারপর MCH কার্ডিওথোরাসিক সার্জারি করেছি, করে অস্ট্রেলিয়াতে যে আমি হার্ট সার্জারি শিখে এসেছি, এসে কলকাতায় অ্যাপোলে জয়েন করেছি। আপনার পায়ের ধুলোনিতে একদিন যাবো, এই আপনার ওই বকুনিগুলো আমার সারা জীবন মনে আছে, আর ওই বকুনির তলাতে আমি পড়ে যেতাম, বুঝতে পেরেছো? এই দিস মেসেজ ইজ কিং না হোয়াটসঅ্যাপ। আমি বললাম যে তুই তাহলে আসবি, আমি বললো ঠিক আছে আমি যাবো। তো